Hello everybody, this is Dr. Az and MRCS ED, and today we are going to discuss an anatomy station. It's about the skull. Skull shows up in many previews and many perspectives. This is one of them. You have nothing to do with this station other than memorizing only. You want to remember the parts, okay? We are going to move in order from one forward, okay? So this is number one, this is the anterior lacrimal crest. This is number two, this is the anterior nasal spine, the anterior nasal spine. This is number three, this is called the body of the mandible. Here number four, this is called the condylar process of the mandible. Here number five, this is called the coronal suture, connecting the frontal and the parietal parts of the skull. Here, this is number six, and this is the coronoid process of the mandible. And here, number seven, this hole is the external acoustic meatus of the temporal bone. There are many parts of the temporal bone that are going to show up here. You want to remember them. So this is the acoustic meatus, this is the first one. And number eight here, this is the external occipital protuberance, or you can call it anion, okay? Number nine, back to the lacrimal area, this is called the fossa of the lacrimal sac. Fossa of the lacrimal sac. Let us go to number 10 here. This is the frontal bone. Number 11 here, this is the one. This is the frontal process of the maxilla. Okay. And we are going to, yes, this is number 12 here, connecting the frontal and the zygomatic bones. This is called the frontozygomatic suture. The frontozygomatic suture. This is the one, okay? Number 13, most probably they are not going to ask you about it, but just to know, this is the glabella, okay? Well, number 14 here, this is the greater wing of the sphenoid bone. Okay? Here, number 15, this is the inferior temporal line. Here, this is number 16. This is called the lacrimal bone. Okay. Number 17, back here. This is the lambdoid suture, connecting the parietal and the occipital bones. Lambdoid suture. Okay. Number 18 is the mastoid process of the temporal bone also. Okay. Number 19. Let's find them. Yes, here it is. This is the maxilla. Okay, here this area. Number 19. Number 20 is the mental foramen, and number 21 is the mental protuberance. 20 is the mental foramen. 21 is the mental protuberance. Here you are. This area is done already. Okay. 22. This is the nasal bone. 23. This is the nasion. Most probably nobody is going to ask you about it also, but you want to know it. This is the nasion, nasal bone and nasion. Okay, and here back, this is the occipital bone, 24. Okay, and here inside the orbit, 25. This is the orbital plate of the ethmoid bone. Number 26, here, this is the parietal bone. Okay, we are going to move to 28. 28, you remember this is the anterior lacrimal crest. This is the fossa here, fossa for lacrimal sac, and here this is the posterior. 28 is the posterior lacrimal crest. Okay. So number 29, this circle here, this is the theroid. It has clinical significance, as you know. And here number 30 is the ramus of the mandible. This is the body of the mandible. Number 30 is the ramus of the mandible. Here number 31, this is the squamous part of the temporal bone. Okay. And here down here, this spine, this is very important. This styloid process of the temporal bone. You remember here, this is the inferior temporal line. So this 33 is the superior temporal line. Okay. And number 34 here, this part here, this is called the tympanic part of the temporal bone. and here this is the 35. This arch is the zygomatic arch, and 36, this is the zygoma itself, or it's called the zygomatic bone, and 37 here, this 37 is the zygomatic process of the temporal bone. Okay, so just you need to see it 1 or 2 times and you are going to remember all the parts. We are going to see another skull station soon, so you are going to know all the directions from which they are going to ask you in the MRCS Part B or any anatomy exam. Thank you so much, and see you later.